Now we are moving towards the heart, the topic of heart, guys. So as I told you the entire planning, how we are going to approach the heart, the thorax topic. So we have completed the thoracic wall. Now we'll enter inside. Inside we are going to learn about the two important organs. One is your heart, another one is your lungs, guys. So first, let's begin the covering of the heart. So in this topic, we are actually now going to discuss about the pericardium, guys. So heart is covered by pericardium. Now try to recall in your mind, the pericardium is made up of how many layers? Okay. Remember, the pericardium, the outermost layer of the pericardium will be fibrous pericardium. And just inside the fibrous pericardium, you will be having the serous pericardium, guys. So there will be outer one, that is fibrous pericardium, and then inside that will be having the serous pericardium. Now that serous pericardium will be in turn divided into two layers, the outer one being the parietal and the inner one will be the visceral, guys. So in short, I can say that the pericardium is made up of how many layers? 3 layers. And try to do one thing, read my table from below. So which is the outermost layer of the pericardium, guys? Number 1, fibrous pericardium. Fibrous pericardium. Number 2, just inside the fibrous pericardium you will be having parietal serous pericardium. And then inside that you will be having the visceral serous pericardium. That is the best way and easiest way to learn them. Now I am not going to leave it like that here. Let's draw a small simple diagram so that we can understand the arrangement of all these 3 layers, guys. Okay. So let us draw a schematic diagram. Now in this diagram, you just imagine that this is our heart here, sir, and our heart divided into 4 chambers. This is the simplest diagram of the heart possible. Don't worry, later on I will make you draw the exact diagram of the heart also, but for now just a schematic diagram. Now our heart is covered by pericardium. You imagine this black colored line to be pericardium, guys. Now what I am going to do is, I am going to take a small part of this out here and let's zoom that. Okay. So therefore, what is that red colored line, guys? That red colored line will be the wall of the heart. So this one will be the wall of the heart. And we all know that the wall of the heart is actually covered by pericardium, and the outermost layer of the pericardium will be the fibrous pericardium. So imagine this black colored line here to be the fibrous pericardium. I am just writing as FP in short. Just inside the fibrous pericardium, you will be having one more layer, that is parietal serous pericardium. That is parietal serous pericardium. Now I want you all to understand one thing here. If this is the fibrous pericardium, the parietal serous pericardium will be adherent to that. It will be attached to that one, guys. So there is no space between them. Just for the sake of understanding, I am drawing the diagram like this. But keep in mind, there is no space between the fibrous pericardium and the parietal serous pericardium. Then where do we have the visceral serous pericardium? Visceral serous pericardium will be actually attached to wall of the heart. So this one will be the visceral serous pericardium. This is how all the 3 layers are actually arranged. Now once you have understood the arrangement, we can clearly understand from my picture here that yes, between the parietal serous pericardium and the visceral serous pericardium, between these 2 layers you will be able to find the cavity, and this cavity will be the pericardial cavity, guys. And inside this pericardial cavity you will be having fluid, and that fluid is nothing but your pericardial fluid. And I want all of you to please remember the normal amount of the pericardial fluid, guys. It has been asked in the exams. So the normal amount of pericardial fluid is somewhere around 50 ml, 50, guys. The maximum amount of the pericardial fluid will be 50 ml. That's a simple thing just to get started with. You know, as usual, our habit, every topic we are going to start from the scratch and then we'll go to all the higher things, guys. Okay. So that is the simplest thing. Now once you have understood the 3 layers and their arrangement, now I want all of you to understand one more important thing regarding pericardium in detail, guys. That is pericardial sinuses. But to understand that, try to understand the orientation of the diagram. Is it okay? So just everyone please observe here at me. Now just imagine that this is our heart here. For example, if this is our heart here, try to understand the orientation, how we are looking at the diagram now. So this is our heart here, and our heart is actually covered by a layer known as pericardium. Fine. Now what I am actually doing here is, I am actually going to remove this heart from here. Okay, and keeping the pericardium as it is. Are you getting me? So I am removing the heart from here, keeping the pericardium as it is. Now after that we are actually looking inside the pericardium. So when you look inside the pericardium, obviously I am able to see certain openings. Why, sir? Why? Because there are so many blood vessels which are actually going to enter into the heart and leave the heart. And all those blood vessels which are entering the heart and leaving the heart, for example like superior vena cava, inferior vena cava, pulmonary trunk, pulmonary veins, all of them which are entering and leaving the heart, they are going to pierce through the pericardium. Understanding my point here? So that's the reason why the moment I remove my heart from here, keeping the pericardium as it is over there and looking inside the pericardium, I'll be able to find certain openings there. So I'll tell you here, for example, here you'll be able to find the opening for superior vena cava. Below here you'll be able to find the opening for inferior vena cava. And then there will be opening for aorta and pulmonary trunk. Then there will be like 4 openings for the pulmonary veins, guys. So let me show you a picture for this one. Everyone just look at this diagram here. So in this diagram we are able to see here there will be ascending aorta here, guys, and this will be the pulmonary trunk here. And then the one which is collecting the blood from upper half of the body, that is superior vena cava here, and then this one will be the inferior vena cava opening over there. And then the remaining 4, these will be the 2 pulmonary veins, and these will be the 2 pulmonary veins from each lung on either side, guys. So this is what exactly I was trying to tell you. Okay, we have our heart, remove the heart and just look inside the pericardium, you will be able to find all these openings. Now let's do one thing here, not only this diagram here, sir, let's draw our diagram right now. Okay, so for example, if this one will be the pericardium without the heart. Now inside this pericardium you will be able to find, first of all, there will be opening for ascending aorta, and then there will be opening for pulmonary trunk. Fine. And then here you will be able to find there will be opening for superior vena cava, and then there will be opening for inferior vena cava. This is SVC and this is IVC, inferior vena cava. And then you will be having like 4 pulmonary veins, guys. So 2 pulmonary veins from each lung. Now look at the way, like what I am trying to do is, I am drawing that pulmonary trunk and ascending aorta in a red color over there. I just want you to have a clarity, okay, those 2 are the one which are going to distribute the blood from the heart. They are going to take the blood away from the heart, they are going to supply the blood. Whereas superior vena cava, inferior vena cava and pulmonary veins, all of them are going to bring the blood back into the heart. Understanding? So therefore my dear friends, I want you all to understand, superior vena cava and these pulmonary veins and this inferior vena cava, all this belongs to our venous category. They are the one which are going to bring the blood back to the heart. Whereas aorta, ascending aorta and pulmonary trunk, these 2 are going to take the blood away from the heart. So these 2 comes under which category? Arterial category. Arterial category. So basically what is happening here, when the blood vessels are entering and leaving the heart, the innermost layer of the pericardium, that is visceral serous, close to that one, is being reflected. It's being reflected, guys. I think you have appreciated that in the diagram over there, which I have shown you. Yes. Now observe the diagram, you will understand more clearly. So that pericardium layer, the innermost layer of the pericardium is getting reflected there, separating the arterial tube and the venous tube, the arterial end and the venous end. Understanding? Now because of this, what is going to happen? Now because of this, what is going to happen is that, because of that reflection, what is going to happen? Yes, there is a sinus which is created here, and this sinus between the arterial end and the venous end is said to be the transverse sinus. So this sinus is transverse sinus. Okay. So basically where do you have the transverse sinus, guys? The transverse sinus is between the arterial end and venous end. So between that arterial end and the venous end, you will be able to find the transverse sinus. Now the most important thing which has been asked in the exams recently, like what are the relations of this one? And what is happening is, most of the time now during our first year MBBS time, this diagram, the students are unable to understand exactly. You have to understand that in a little bit of 3D, guys. So just look at me here, our same orientation. So for example, if this is our heart here, heart is covered by pericardium here. I am removing the heart, keeping the pericardium as it is. Now try to understand that. For example, here if I am having superior vena cava, below I am having inferior vena cava, then there will be like 2 and 2 like 4 pulmonary veins there, and all of them are present on my palm here. For example, you just understand the plane here. The superior vena cava, inferior vena cava, and the 4 pulmonary veins are present here behind. And now what I am trying to make you understand is that pericardium is not present straight here. Actually, it is taking a turn here like this. This is our heart. And because the pericardium is taking a turn here, you have your ascending aorta over here, okay, moving out, the red colored here, and then this will be the pulmonary trunk which is moving out like this. Understanding? So, ascending aorta and pulmonary trunk, these two are together going to form the arterial end. The superior vena cava, inferior vena cava and the pulmonary veins present behind are going to form the venous end. Now, between this aorta and the pulmonary trunk, okay, that is your arterial end and the venous end, here if I insert the finger, I will be able to see my finger on the other side. Wow, beautiful. So, this is actually a space, sinus over there, and that sinus is nothing but the transverse sinus, guys. Understanding here? So, that is what is the clarity I want in your mind, guys. That is the transverse sinus. Now, you can easily tell me what is present anterior to transverse sinus? Ascending aorta and pulmonary trunk. What is present posterior to transverse sinus? Superior vena cava along with the pulmonary veins. Okay. So, that is the easiest way to understand that one, sir. So, therefore, start writing the notes with me now. Anteriorly, transverse sinus, anteriorly you will be having ascending aorta and pulmonary trunk, and posteriorly it will be bounded by superior vena cava and pulmonary veins. That is the easiest way to remember the relations. Otherwise, in these diagrams now, you will not be able to understand that one, guys. Now, finally, I will tell you one of the application of this one, sir. Why? Why do you need this transverse sinus? Now, during the cardiac surgeries, we need to ligate the blood vessels. We need to ligate the great vessels. So, what's happening here? For example, if this is your aorta here and this one will be the pulmonary trunk here, okay, this transverse sinus is used for ligation of these great vessels whenever you are doing the cardiac surgery, guys. So, ligation of the great vessels during the cardiac surgeries will be, for that we will be using the transverse sinus. That is all the points that you have to remember about transverse sinus. The next one, between the pulmonary veins, you are able to find here, this will be the oblique sinus, guys. This is oblique sinus. Between the pulmonary veins, you will be able to find a space there, oblique sinus. Now, what will be the use of this oblique sinus here? What is the use of this oblique sinus? I will tell you. First of all, try to understand where do you have the oblique sinus. If you look at that image now, both the pulmonary veins, the 2 pulmonary veins from each lung will come and open into which chamber of the heart? Remember, both the pulmonary veins will come and open into, they will open into the left atrium. So, you have to understand in my diagram here that if both the pulmonary veins are coming over there, then what is going to happen there, guys? There will be a left atrium there. So, there are 2 pulmonary veins coming from one side and there will be 2 pulmonary veins coming from the other side. That means the oblique sinus is just behind the left atrium. It is just behind the left atrium. Now, sometimes what will happen when the venous return will increase? What will happen? The left atrium will enlarge, it will bulge, and for that it requires some additional space. So, that is the dead space for enlargement of the left atrium whenever there is increased venous return. Beautiful. There will be a dead space behind the left atrium whenever the left atrium bulges or enlarges whenever there is increased venous return, guys. Otherwise, what will happen, you know, if there is no space present there, if there is no oblique sinus present there, then just behind that oblique sinus, there will be esophagus passing from there. So, there are chances that esophagus can be compressed. So, to avoid the compression of esophagus, we are having that oblique sinus. Hope you understood the entire concept behind that. So, it's not just, you know, mugging, guys, writing the heading as sinuses of pericardium. There are 2 sinus, transverse and oblique, and just mugging up. No, there is a beautiful concept behind that one. Okay. So, now from here we can understand what you have right in front of the oblique sinus. Anterior to that one, you will be having your left atrium. And then what you have behind the oblique sinus, there will be esophagus. It will be easy for us to remember these relations right now, guys. That is the reason I told you, right? Whenever left atrium bulges due to increased venous return, yes, it will avoid the compression of esophagus, because we are already having a dead space present there known as oblique sinus. So basically in this diagram, basically what are we learning here, sir? We have learned about the sinuses of pericardium. Sinuses of pericardium. There are like two sinuses in pericardium. One is transverse, another one is the oblique sinus, guys. Hope the concept is crystal clear. Now after learning the covering of the heart is covered by pericardium, all the layers and the sinuses in pericardium has been completed. Now let's go towards the heart. And in the heart topic, first of all, let me tell you the external features of that as well as the positioning of the heart, like the apex, the base, the inferior surface, the lateral surface. Many students are confused here. Whenever you ask in the live class, they'll be like left atrium, right atrium, everything is forming every surface. So now I'll teach you in the easiest manner possible, guys. To understand the positioning of the heart, first of all, you need to answer me here, like what will be the shape of the heart, sir? Like what is the shape of the heart? Now during our live classes, whenever I ask this question in the class, most of the students will be answering, sir, it is like fist, the closed fist. Understand the difference. Closed fist is actually the size of the heart, not the shape of the heart. Remember, our heart is actually cone shaped. It is cone shaped. And whenever you have a cone, there will be like base, the apex, and then there will be two sides. Okay, sir, very understood. It is cone shaped. But how it is present exactly inside our body? I agree that our heart is like cone shaped, but how it is present exactly inside our body? I will tell you one statement. Try to remember that. Everything else will become easy for you. Remember, our heart is present inside the body as if like a fallen cone on one of its side. I repeat the statement again. Our heart is present inside the body like a fallen cone on one of its side. Okay. So for example, if my hand here like a cone, apex here, then the base here, then this is one side, another side. Fine. And now make this cone fall down like this. It's like a fallen cone. So where do you have the apex of the heart? Somewhere here. This is the apex of the heart. And where do you have the base of the heart? That is like confusing for many students. Base is not at all present over here, guys. Once it is fallen like this is the apex, and here you'll be having the base of the heart. Understanding? And this will be the inferior surface and this will be the lateral surface. So that's the easiest way to understand the positioning of the heart. Our heart is like a fallen cone on one of its sides. So first I'll just make you draw that small diagram here so that you understand. For example, if this is your cone here, a cone will always have a base, then there will be apex, and there will be a side here and a side here. And our heart is positioned as if like a fallen cone. So let the cone fall down like this. So here comes the apex, and this will be the base, guys. And this is like one side, other side. Understanding? Exactly like that. Now after this, let us draw one schematic diagram for understanding all the surfaces, guys. So imagine this one to be the superior vena cava here. And imagine here this one to be the inferior vena cava. Superior vena cava, and this one is the inferior vena cava. And our heart is like a fallen cone. Perfect. Now we all know that superior vena cava, inferior vena cava, both of them will drain the blood into which chamber of the heart, guys? They are going to drain the blood into right atrium. And from the right atrium, the blood will be going into which chamber of the heart? Here will be the right ventricle. And behind the right ventricle, you'll be having the left ventricle, guys. Behind that, you'll be having the left ventricle. That's all. Such a simple diagram. If you draw this, this type of questions will become easier for you guys. Now, in this diagram, just keep on looking at the diagram and keep on answering right now. What is forming the apex of the heart, sir? Remember, the apex of the heart is formed by left ventricle without any doubt. And can you just recall and tell me what is the position of the heart, sir? It is formed in the left it is formed by left ventricle. What is the position? Where exactly? Remember, it is present in the left fifth intercostal space. The apex can be located exactly in the left fifth intercostal space, which is almost like 9 centimeters away from sternum. 9 centimeters away from sternum, guys. So the apex of the heart will be formed by left ventricle, and it is present in the left fifth intercostal space, and it is like 9 centimeters away from sternum, guys. That is about the apex. Then similarly, what about the base of the heart, sir? You remember the base of the heart is formed by right atrium, not only the right atrium, even the left atrium. Now here I have seen like many students getting confused. Try to understand, guys. I am asking you like complete base of the heart. In the diagram you are able to see only the right atrium in the front, but there is a left atrium behind, and together they are going to form the base of the heart. Be very careful, I am not asking the border, I am asking the complete base of the heart. Okay, so base of the heart is formed by right atrium as well as the left atrium, guys. And you should also know that out of these two, right atrium will contribute only 1/3, whereas left atrium will be contributing 2/3. Okay, so already this type of question has been already given in the exam. Then after that, remaining things are easier. Now what is forming the inferior surface of the heart? You can just look at my diagram and tell me, guys. The inferior surface of the heart partly will be contributed by right atrium, partly will be contributed by right ventricle, as well as there will be a little bit contribution from the left ventricle also. What about the lateral surface of the heart, guys? The lateral surface of the heart is formed by left ventricle. Along with the left ventricle, here you will be able to find a ear-like projection. And this ear-like projection here is nothing but auricle. Which auricle? Left auricle. So the lateral surface of the heart is formed by left auricle also. Left ventricle and left auricle. Now, is there any more questions which are possible here? Yes. In your exams, they have even asked about the right border of the heart. So just look at the diagram there, guys. Right border of the heart is actually formed by only the right atrium. This time be careful, I am not asking the entire surface, only the right border. So the right border of the heart is formed by right atrium. Now suppose if they ask you the question like what is forming the right cardiac shadow? Right cardiac shadow. Already this type of question has been given in the exam. There was a chest X-ray given in that right cardiac shadow, and right cardiac shadow is formed by superior vena cava as well as inferior vena cava as well as the right atrium. So best way to remember SIR, superior vena cava, inferior vena cava as well as the right atrium. The mnemonic to remember that is SIR. So the right cardiac shadow is formed by superior vena cava, inferior vena cava and the right atrium, guys. Okay, so hope this simple diagram will make everything easier for you, whether it is the apex of the heart, the base of the heart, the inferior surface, the lateral surface, right border and the right cardiac shadow. So I request all of you to do one thing, draw this diagram, practice this diagram twice or thrice, guys, that's all. Don't try to mug up these things, you will never be able to remember right, left, atrium, ventricle, it will be a lot confusing. Best way, practice this diagram 2 or 3 times, you will become perfect. So after this, what you can do is you can just compare this with this diagram here. Let's have a comparison, sir, quick comparison. Superior vena cava here and this one is the inferior vena cava, and both of them will drain the blood into right atrium of the heart, and this will be the right ventricle here. Behind the right ventricle, you will be able to find the left ventricle. That is the reason why the apex of the heart. So this is the apex of the heart, you can clearly see it is formed by left ventricle. This will be the base of the heart, which will be formed by the right atrium and the left atrium behind, and I hope you will be able to manage with the remaining things. The inferior surface of the heart, which is formed by the right atrium, right ventricle and the left ventricle, and this will be the lateral surface. And I want you all to appreciate one thing on the lateral surface, this is the auricle here, sir. This is left auricle, left auricle. I hope you will be able to easily understand. Now at the end of this, what I want you to do is that, okay, pause the video for 2 seconds and then just have a comparison between the diagram present in our textbooks and then the diagram which we have drawn here. Just have a comparison and things will become easier for you guys. That's all about this.